Use rice to save your knee.
Let's talk about your knees. Why do they click? How to deal with them? Simply, your knee is a high-stress joint where three bones meet: thigh bone, shin bone, and they are covered with the cap. The pain may come from different structures: bone and cartilage, ligaments, tendons, fluid and internal structure. First comes first, bone and cartilage. The articular surface between thigh bone, shin bone, and the kneecap, these surfaces are covered by a material called cartilage. This cartilage makes the movement easier and protect against the friction between the bones. When this cartilage is injured and it wears out, the bony ends will be exposed. Then there will be friction between the exposed bony parts. This friction between the bones will cause grinding pain. This sensation is the grinding sensation that you feel in your knees. That happens usually with the old age. Number 2, the ligaments. Your knee is supported with a set of ligaments. These ligaments are meant to support the knee and stabilize it during the movement and standing. Any injury or tear of these ligaments will lead by the end to pain in the knees. Not only pain, it also leads to instability of the knee joint. If you have a ligament injury, you will feel that your knees are giving away. Number 3, tendons. Tendons are different from the ligaments. Overuse of the knee joint causes injury of the kneecap tendon, which we call patellar tendonitis. The patient who has tendon problem will feel sharp pain while jumping. Number 4, the meniscus. The meniscus is a structure inside the knee joint. It's a cushion-like structure that acts as shock and load absorbent. When the meniscus is injured, there will be stiffness and locking of the knee joint. At that point, you will not be able to fully bend or straighten your leg. Now the question, who is at risk? Are new moms the only victims? Not only new moms, but also these people are at high risk. Number 1, the runners. The repetitive load on your knees during running compresses the cartilage inside the knee joint, causing pain. Number 2, desk workers. Sitting for a long time on the desk weakens the muscles of the butt and the thigh. That forces the knee joint to compensate their action while standing up. All this is an extra load on the knee. Number 3, gym people. If you do squats and lunges in poor technique, that leads to shearing of the kneecap. Number 4, the poor victim, the mother. Carrying the kids is an extra load on your knees. This is not the only problem. After delivery, the mother has some sort of ligament laxity that leads to overstretch of the knee ligaments in the new moms. As a result, this will lead to instability and some pain. So, when to see the doctor? There are some warning signs and red flags. Most of knee pain improves by rest, but you have to seek the medical advice if you have any of the following symptoms. First, swelling and fever, as it could be an infection of the knee joint. Inability to bear weight. Number 3, inability to fully bend or straighten your legs. It may be a knee locking. Any numbness below the knee because it may be a nerve injury. Can rice relieve your knee pain? For the quick relief, there is some steps that you can do. First, the rice method. Rice is an abbreviation for rest, ice, compression, and elevation. So you have to rest your knees, apply ice packs, do some compressions, and elevate your leg above the waist level. You can do this elevation by using a chair or a table. Number 2, use some braces to support your knee and prevent it from instability. In addition, you can use some painkillers. These painkillers could be topical painkillers like the gel and the creams, or you can take some painkiller tablets. For the long-term management and prevention of the knee pain, first, strengthen your leg, especially the squat muscles. Some studies show that almost 80% of the knee pain is due to weak squat muscles. Number 2, usually check your footwear. The worn shoes misalign the knees, and this misalignment will lead to knee injury as we mentioned before. At the end, if you have any story with the knee pain, I'd like to hear it. Write a comment if you want to ask about something or you need me to talk about something specific. Like, follow, subscribe, and share this with someone who may need it. See you.